Today, what we're going to look at, this was just released. It was just published online, January 2nd, 2024. And it's called The Effect of Slow-Paced Breathing on Cardiovascular and Emotion Functions, a Meta-Analysis and Systematic Review. The first author is Robin Shao, Shao. So we're going to look at that. We looked at nasal breathing, right? So when I say there's all these, in research, we take a very minimalistic perspective. We need to do what's the thing that we can change that we can then measure. Because if there's too much in the environment that's going on, it's hard to say that this is, that's the reason, right? We're trying to look at cause and effect. And so you can see, right, just from the last article we looked at, which is acute nasal breathing. So that's like, hey, look, I'm going to let you chill out for 5 minutes, and we're just going to see what your natural breathing pace is. And we're going to ask you to breathe with your nose as best you can. And we're going to measure a whole bunch of things. All right. And then we said, they didn't specifically say breathe slowly and use your nose. And so this group specifically went on slow paced. So this is slowing down your breath. And we've talked about this. This is what's called a meta-analysis. And if you're ever familiar with meta-analyses, what meta-analyses try to do is what happens is that people that are interested in a certain topic, they might have 20 or 30 people that they can study, but let's say it's large enough to come up with certain conclusions or to do certain statistical analyses. But oftentimes you need hundreds of patients to really see things that have small effect sizes. So the larger the effect size, the less number of people that you need to measure or study to see the effect that you're actually trying to look for. The smaller the effect size, you have to study a larger number of people. So what a meta-analysis is, it's sort of like an analytical way. It's kind of like a statistical way of, even though the studies aren't the same, that they take individual studies that have been performed. So somebody, let's say in Germany, does a study with 20 people. Somebody in Canada does a study with 20 people. Somebody in Japan does a study with 20 people. Somebody in USA does a study with 20 people. And what this group tries to do is essentially tries to say, can we pool all the data? Can we pool all the data that we can collect from these now 80 people, because we have 4 studies that have done it for 20 people. And now can we do an analysis on that data? So it's sort of like going back to the raw data and saying, and pooling it and seeing, can we actually do a study on that? All right. That's kind of like a very basic description of what a meta-analysis is. All right. And so we'll be covering that today. So let's go into this, because we talked about nasal breathing last week in that study that just came out, which is, quite interesting, looking at increasing that parasympathetic tone, right? So what are ways that we're actually increasing the parasympathetic tone in our life? We have a lot of stress, which is activating the sympathetic tone. And so how are we balancing that, right? And this needs to be a question that we ask ourselves every single day. It needs to be a practice that we have every single day. This is not something that is sort of like, I'm going to do it once in a while. Can't be like that, because daily life just is stressful for most people. There's some sort of stress that comes up. Our sympathetic nervous system is activated. We're lacking balance in that sympathetic parasympathetic. So in order to bring in balance, bring in that resiliency, we've got to do exercises. We've got to exercise that system. And this is one of them, right? So nasal breathing, showing that increases parasympathetic tone. It decreased that mean or diastolic blood pressure. and it increased heart rate variability. This now looking at a meta-analysis, so pooling the data from studies together and doing a review of slow-paced breathing. So again, I'm going to read the abstract here. Slow-paced breathing entails voluntary controlling one's breathing rate to a frequency close to the oscillation frequency of the cardiovascular system. Accumulating evidence indicates slow-paced breathing improves cardiovascular and emotional functions. However, there is no meta-analysis that quantifies pooled effect of slow-paced breathing across studies with non-clinical populations. All right, so that's what they wanted to do. They wanted to pool these studies. So take them. So there's all these like kind of individual studies. So growing evidence, right? There's all these kind of individual studies. They wanted to try to pool this all together and do a statistical analysis on these pooled studies. So what they did is they went and they looked at every single study that looked at slow-paced breathing, and they found 1,421 were identified. 1,421 studies were identified. That's a pretty good number of studies, but they had a certain inclusion criteria where it had to meet a certain level of standard. So imagine this, right? Here's how much decreases. So they identified 1,421, and the studies that were included in the meta-analysis were 31 studies. So you can see that how much attrition rate is, how much attrition is actually in there. Let me see if I can get the number of people. Oh, here we go. 1,133 people. So not bad, right? If you're looking at 1,130, that's pretty hard to do if you're just one researcher. But this is what that pooled data is doing. Okay, so they looked at and they found, investigated the effect of slow-paced breathing on cardiovascular and emotional measures. Slow-paced breathing, also termed deep breathing or slow abdominal breathing, is a stress reduction practice in which the person voluntarily slows down the breathing rate to a frequency close to 6 cycles per minute. All right, so there's that magic number again, 6. They've done studies on this. This is kind of when you do come down to below, for instance, 10 breaths per minute. There's greater entrainment in the brain waves. So 6 cycles per minute. We usually breathe probably anywhere between 10 to 18, 20, 22, depending on what our history is. This frequency matches the resonance frequency of the cardiovascular system with key physiologic functions such as heart rate and blood pressure. It is known that the heart rate and breathing synchronize, are resonating at about 6 breaths per minute. That's cool. So your heart rate and breathing start resonating at about 6 breaths per minute. So if you think of yourself, think of yourself as a musical instrument. And how are the functions of your body creating waves, creating sound, creating electromagnetic frequencies that are emanating, and how are those waves resonating or not? So it's kind of interesting to think about, wow, am I in resonance? Is my breathing rate in resonance with my heart rate? Is my breathing in resonance with my heart rate? They've actually done studies, interesting studies, when they look at like therapist and patient interactions. They've done a few of these studies in the psychological realm. When there is a good patient clinician rapport, and when there is an aha moment that occurs in therapy, that is actually that they've measured that there's actually entrainment between the heartbeats when there is an aha moment between the therapist and the patient. So just kind of thinking about the energy, right? The energy that we're transmitting or receiving from somebody else, or that energy when you're coming into relationship with somebody else. how that energy is either, there's either some sort of attraction or level of comfort, or, it's kind of like repulsion. The waves are bouncing off each other and not having cohesion. Well, just thinking about yourself, right? Breathing and your heartbeat and your respiratory beat being in resonance. Kind of neat. Breathing at resonance frequency is considered to maximize the amplitude of heart rate oscillations and heart rate variability. Consistent with this, slow-paced breathing near resonance frequency is considered to produce the greatest heart rate variability and baroreflex gain. So again, we looked at a lot of this should hopefully be familiar with you if you've been listening to me, in terms of slowing our breath down, being conscious of our breath, now brings on the parasympathetic nervous system, brings on that vagus tone, right? We're toning our vagus nerve, which in line then starts to increase our heart rate variability. So we have increased heart rate variability. What that means is that, right, as we take an in-breath, our heart rate is actually linked to the sympathetic system. When we exhale, our heart rate is linked to our parasympathetic system. So increased heart rate variability means that as you go through the cycle of breathing, inhale, exhale, that you're actually exercising the sympathetic nervous system and the parasympathetic nervous system, and the sympathetic nervous system and the parasympathetic nervous system, and the sympathetic nervous system and the parasympathetic nervous system. So each breath, you're getting this balanced exercise between the two nervous systems, which is sort of awesome, right? If you want to bring resiliency and balance to a system, well, what do? Well, you exercise both of them, right? Sort of like, I'm going to exercise my biceps and my triceps, right? So I have a strong arm as opposed to just exercising my biceps. Okay, or I do my right side and my left side. Okay, but we want that nice dynamic system to be exercised. Okay, and this is how it links in with mindfulness practice. Right, while slow breathing is not necessarily an instructed component in mindfulness practice, it can happen as a consequence of mindfulness meditation. Right, how many people have been in a deep meditation and you're sort of wondering when your last breath was? In like the introductory mindfulness class, you might pay attention to the breath or the sensation of your breath, but there's very little instruction in terms of like, okay, now decrease your rate, right? We've done that here multiple times because we try to link all this together. But when you start paying attention to your emotions, thoughts, sensations, feelings, or just the sensation of your breath, what happens naturally is that your breath the frequency of your breathing starts to decrease. Okay. It can happen as a consequence of mindfulness meditation and has been integrated with mindfulness practice to form combined intervention techniques. It has been found that slow-paced breathing shows high efficacy in reducing daily stress and in promoting mental wellness under chronic stress. As stress is known to activate the hypothalamic pituitary adrenal axis, that in turn leads to widespread physiological consequences, particularly in the cardiovascular systems. The effectiveness of slow-paced breathing in enhancing cardiovascular health is particularly noteworthy. So we know that when people get stressed, they have arterial constriction. Your blood pressure rises. Then you go to the doctor, and does the doctor ask you, have you been stressed lately? No, they just tell you have high blood pressure and they give you a medication. Okay. Accumulating evidence supports the efficacy of slow-paced breathing in treating hypertension, prehypertension, and in improving cardiovascular control in patients with chronic heart failure. Whoa. Further intricate associations exist between cardiovascular disease and mood disorders such as depression and anxiety, both of which could be triggered by chronic stress. In this context, a systematic synthesis of existing literature on the effects of slow-paced breathing on cardiovascular and emotional processes is important for elucidating the psychophysiological mechanism underlying its therapeutic efficacy. All right. So again, we're looking at a similar thing to, the potential of like a blood pressure medication here, as well as improving your emotional well-being. So now you have a medication, right, that not only decreases your blood pressure, but also improves your emotional well-being. Again, as I've said numerous times, based on this practice, this would be something that they would probably put in our drinking water. Okay. But this is called slow-paced breathing. Anytime there's mounting evidence. There's mounting evidence that shows that nasal breathing, does these really great things. There is mounting evidence that shows that slow-paced breathing does these really great things. It's just another tool to add to our repertoire of ways that we can help decrease stress, that we can activate the parasympathetic nervous system and balance that parasympathetic, sympathetic nervous system and increase vagal tone. Maybe you're going to improve your cardiovascular health and decrease stress and decrease blood pressure if you're pre-hypertensive or hypertensive. Several reviews and meta-analyses exist which summarize previous research on the psychophysiological effects of slow-paced breathing. The existing reviews suggested that slow-paced breathing improves cardiovascular functions such as heart variability, blood pressure oscillations, decreasing systolic blood pressure and diastolic blood pressure. Slow-paced breathing additionally promoted positive emotional states and reduced negative emotional states such as anxiety and depression. Right. So the acute nasal breathing study, if you remember, lowered diastolic blood pressure. That's that bottom number on the blood pressure. Slow breathing has been shown to actually decrease systolic blood pressure. Systolic, which is the upper number. Okay, so in the article, if you pull it out, is a PDF of it. Interesting things. What I like to look at is a few things, but I like to look at what the intervention is and what the duration is, right? Because at the end of the day, I'm still a physician, and what's the number one question that you all ask me? How slow do I gotta go and how long do I have to do it? Right? How slow do I have to go and how long do I have to do it to get the maximum benefit, right? We all ask that about exercise. How long do I have to walk? Is it 10,000 steps? Is it 6,000 steps? Is it 5 minutes? Is it 10 minutes? What's the maximum benefit I get? Okay. Slow. So just to give you a sense, all right, what has been my answer all along? 5 minutes is the least number, right? That's the least intervention duration. Okay. But here's the studies that they found out. And I just want to give you a sense, right? That there's no like one answer, right? It's really what works for you. And that's the beauty of it. Okay. But we can try to make certain generalizations. So intervention, number of breaths per minute. Are you ready? I'm going to read down the list. Less than 10, 4.5 to 7, less than 10, 6 to 8, 5, 6, 6, 6, 6, 6, 6, 6, 6, 6, 6, 3.3, 10, 6, 10, 6, 3, 6, 5 to 6, 5, 9, 6, 10, 3.3, 6, 6, 6. What number jumped out at you on that one? 6, okay? That was the number of breaths per minute. All right, you can see the variability of that, right? From 3.3 up to 10. Usually what they say is try to get it 10 or less. 10 or less, okay? Now there's the intervention duration, okay? Intervention duration. So again, I'm going to go through the list. You can hear 15, 20, greater than 10 minutes, 20 minutes, 30 minutes, 5 minutes, 120 minutes, 45 minutes, 15 minutes, 17 minutes, not applicable, 60 minutes, 15 minutes, 20 minutes, 6 minutes, 30 minutes, 10 minutes, 3 minutes, 15 minutes, 15 minutes, 5 minutes, 5 minutes, 15 minutes, 10 minutes, 5 minutes, 15 minutes, 5 minutes, 20 minutes, 25 minutes, 5 minutes, 10 minutes, 15 minutes, and 20 minutes, 15 minutes. Okay, so my recommendation always is do it for at least 5 minutes. That is clearly what the studies have shown. That you are, if you do something for 5 minutes, you are going to get the benefit from that, whatever the benefit might be. Of course, right? More, if you can go 20 minutes on this, you're just exercising that nervous system for a greater duration. And so that nervous system is getting that practice, right? Right. So this is where, right? So now the recommendations, there's more evidence that's building behind the recommendations, okay? For a global approach, if you can, which is, right, when you are stressed, try to slow down your breathing. Breathe with your nose. And if you want, extend the exhale, if you can. So that's a shorter breath in and a longer breath out. Okay, this is what they found. So they pooled all this data. They did all these statistical analyses, and this is what they found. Slow-paced breathing showed significant immediate effects reducing systolic blood pressure. Immediate. Increasing heart rate variability. Decreasing heart rate. So immediate effects in reducing systolic blood pressure. Slow-paced breathing. This is when they took all the data, right? So from 1,133 people, they tried to pool all this data. Immediate effects in reducing systolic blood pressure. So remember, the nasal breathing decreases diastolic blood pressure. So now we put them together. The effect in reducing negative emotion, particularly perceived stress, was marginal. Limited evidence. So now we're looking that. So that was immediate. Limited evidence. Now they're saying, can we follow people who are doing these sorts of exercises for a long period of time? But what they noticed is limited evidence indicated persistent reduction of blood pressure 3 months post-intervention among pre-hypertensive samples or people. Preliminary analysis showed moderate association of the physiologic and emotion effects of slow-paced breathing. Right? So there were some studies that looked 3 months post-intervention and it still had effects. Slow-paced breathing, and so their conclusions are slow-paced breathing demonstrated reliable effects in inducing short-term improvements in cardiovascular functions and modest effect in reducing negative emotions, but its long-term efficacy in improving cardiovascular function remains to be established. And you've heard me long enough. What's the next statement? Future studies should continue to investigate the interrelations among the multifaceted effects of slow-paced breathing. You know, we're trying to study a human, right? Which is it's not just a unidimensional individual, right? So when you try to just affect one thing and then see the outcomes, that can be very challenging. So now it's sort of like, yeah, future studies, need to kind of try to put this all together, right? Slow-paced nasal breathing versus mouth breathing versus slow-paced mouth breathing, right? And all these sorts of things where you're not just doing a nasal breathing study, but you're actually telling the people, look, you're going to breathe with your nose and you're going to decrease your breath down to 6 breaths a minute. All right. So what is 6 breaths a minute? 6 breaths a minute is 5 seconds in, 5 seconds out. All right. So remember with the nasal study, right? They did the metronome, and the metronome was set at if you breathe 10 breaths per minute, the metronome was set at 20, and every tick was an inhale and exhale. inhale and exhale, right? So 6 breaths a minute would be a metronome set at 12, right? And so it'd be tick, 2, 3, 4, 5, tick, 2, 3, 4, 5, tick, 2, 3, 4, 5, right? 6, essentially an inhale for 5 seconds and an exhale for 5 seconds. Okay. That's 6 breaths a minute. That's where I go with the research. I go to 6 breaths a minute. If you can get 6 breaths a minute, great. It may take practice and time to get there. Don't force anything. Right? Just like we're not asking you to force doing nasal breathing or anything like that. Be as comfortable as possible. This is not, there's no mention in there of oral versus, this is just slowing it down. Okay? So, slowing it down. Some people, when you're in the practice, actually feel that 6 breaths a minute is fast. Like, wow, I got to take another breath when you're actually in the practice. Okay, so that's what we're going to do for today. That's going to be our practice. All right, looking at, doesn't matter whether it's mouth or nose. You're going to find a comfortable posture, and you're just going to slow your breath down to whatever is comfortable for you. To whatever is comfortable for you. I will look at my watch and give you an indication. I'll do maybe, we'll do maybe a minute where I will count 1, 2, 3, 4, 5, almost kind of be like a human metronome. If you want to get on that pace just to see where you are, try it out. If not, disregard what I'm saying. Okay? Okay, so let's find a comfortable posture. A posture you feel relaxed yet alert. Closing your eyes if you feel comfortable closing your eyes. If not, having a soft downward gaze. And for the next 10 minutes, just allowing yourself to be here now. Allowing yourself to do this practice. That you have no place you need to go. Nowhere you need to be. Just here. And taking 2 or 3 deep breaths. And as you're breathing, feeling the sensation of the breath in your body where you feel it the most as a sensation. You might feel the air moving through your nasal passages or through your mouth. You might feel your chest or belly rising and falling. Wherever you feel the sensation of the breath the most, allowing your attention to rest on that. The sensation of your breath. And just noticing whatever pace you're breathing at. Is your inhale and exhale the same length? Is one longer than the other? Do you pause anywhere in your breath? Do you pause at the end of the inhale or at the end of the exhale, or both, or neither? Just as if you're investigating your breath for the very first time. What does this thing feel like in the body? How does it come in? How does it go out? And just being curious about it in this moment, each breath, just this breath. And now, as best you can, if you want, slowing down your breath, not to the point that you feel out of breath, but just a natural slowing of the pace. And if you wish, you can follow this tempo of breathing in and breathing out, which would be 6 breaths per minute. 5 seconds in and 5 seconds out. Taking an inhale, in, 2, 3, 4, out, 2, 3, 4, 5, in, 2, 3, 4, 5, out, 2, 3, 4, 5, in, 2, 3, 4, 5, out, 2, 3, 4, 5, in, 2, 3, 4, 5, out, 2, 3, 4, 5, in, 2, 3, 4, 5, out, 2, 3, 4, 5, in, 2, 3, 4, 5, out, 2, 3, 4, 5. If you wish to continue going at that pace, or whatever pace works best for you, that was 6 breaths a minute. And just noticing the frequency of your breath now. Has it changed since you began? Or has it stayed the same? And just being curious about it. There's no right or wrong, there's no good or bad. Just this breath coming and going, coming and going. And now taking 2 or 3 deep breaths at whatever pace works for you. Really feeling that sensation in your body of the breath coming in. And as we bring this practice to a close today, really seeing how you might incorporate different breathing styles into your daily life, slowing down your breath, breathing with your nose, simply being mindful of breathing. And now, opening your eyes if your eyes were closed. Reorienting yourself to your room and surroundings. Stretching or moving if you need to stretch. And just taking a moment to reflect on your practice.